Noong nalaman nila na may psoriasis ako, sabi nila, galis yan.
Sabi nila baka nanunuraw ako. Kakalaro ko sa labas ng bahay.
Sabi nila, baka may nakain lang daw ako na hindi maganda.
Sabi nila, sa hangin daw ito nakukuha. Mawawala rin daw to.
Sabi nila, gamitin mo ito. Magsabon ka nito. Uminom ka nito. Gagaling ka.
Sabi nila, mag-sweater na lang daw ako para walang makakita.
Sabi nila, lumayo ako. Baka nakakahawa yung balat ko.
Sabi nila, hanggang dito na lang kami.
Sabi nila, wala raw akong kasama sa labang ito. Sabi ko, nandyan kayo. Panahon na para maitama lahat ng sabi-sabi. Kami naman ang pakinggan niyo.
Alright!
Ayan, good evening.
Hi guys! Na-miss nyo ba kami?
Na-miss nyo ba kami? Ayan, good
Yun.
evening
So,
everyone.
welcome.
Good evening sa ating mga weekenders, no?
Yun. So again guys, welcome to our weekly show. So nagpahinga kami, no? So we're still planning how can we make this Wellness Weekends Philippines better for you guys. So habang we are planning, syempre, may pasulput-sulput tayong mga surprise episodes, no? Which is something na we feel that is very important that you and us should know. Ano ba itong mga sakit na to? Ano ba itong dapat na mga malaman natin? At ano yung mga pinagdiriwang, no? Na mga conditions for awareness every month. Ano bang topic natin ngayon, Coach Alvin?
Ayan, so ngayong gabi, no, we will be talking about Prostate Cancer Awareness Month, since September is actually being celebrated as the Prostate Cancer Awareness Month here in the Philippines. So ano nga ba itong tinatawag na prostate cancer? And ako mismo ay very excited na matuto ngayong gabi.
Yeah, and sa atin, no, especially baka nagtataka bakit dalawa kami yung host kasi syempre, since prostate, sa men yun, no? So, ako rin, it's very eager to learn kasi this is something na dapat natin malaman and something that we should monitor kasi nga, meron tayo nito and baka, sana wag.
Yes.
Diba?
Pero wood ko dito.
Pero maganda, di ba, na alam natin at paano ba siya nadadiagnose or ano ba yung mga symptoms na dapat natin alamin or bantayan kasi, di ba?
Exactly. And ako mismo, no, personally, interesado ako kasi ang daming haka-haka about what prostate cancer is at kung paano siya na-acquire ng isang tao. So, ngayong gabi, as we celebrate ang ating Prostate Cancer Awareness Month here in the Philippines, sama-sama din tayong matuto. And ayan, it's our 50th episode for, again, Wellness Weekends Philippines, your official channel for your weekly guide on health and wellness. Ayan.
Yun. And siguro before we continue, no, just to run through some of our activities kasi bakit ang daming nights na wala si Wellness Weekends Philippines, no? Kasi we just celebrated our 18th year anniversary. So just to flashback ano yung mga nangyari. So we had free skin clinics and bone clinics na ginawa namin in 2 locations. So this one,
no?
sa Mandaluyong to, no? So thank you for the City of Mandaluyong for always partnering with us. And of course, Philippine Dermatological Society and Philippine Dermatology Association. Saan ba yung next, Coach Alvin?
And actually after 1 week now, we had our skin and bone clinic sa Mandaluyong City. We also had one in Sauyo, Quezon City. And ayan, thank you so much to Quezon City government, no, very supportive, and of course ang ating mga partners yan, ang Philippine Dermatological Society and Philippine Rheumatology Association as well.
Yun. So siguro
we had our free skin and bone and clinic, no, with free medicine sa mga pumunta.
Yeah. And almost 400 plus yung mga umattend, no? And we're very excited. Pero baka iniisip nyo, shucks, na-miss ko to. Hindi ako nakapunta. Huwag kayo mag-alala kasi in our World Psoriasis Day celebration, we will also have another run of our free skin and bone clinic. So, do stand by at abangan nyo yung final details. Pina-finalize pa namin, no? So, go lang. And kanina, Alvin, ano ba yung nangyari ngayon? O ngayong araw na to?
Ayan, actually, I was about to butt in, no? Kani-kanina lang, no? Fresh na fresh pa, mainit pa. One of our local chapters, no? Ang Laguna chapter had their sensitivity training naman about psoriasis. Ayan, as you can see on our screen, no? It was attended by a lot of people. And na-explain natin dyan kung ano nga ba ang mga misconceptions in about psoriasis as part of our continuous awareness campaign about our condition. So ayan, congratulations sa Laguna chapter. And kasali ka doon, Coach Pong. You're from Laguna.
Actually, yes. Tapos yun, no, ang pinaka-importante dito sa sensitivity training and awareness na ginawa natin kanina is na-discuss bakit papasok ang sakit na psoriasis as disability. And we are very happy po kanina kasi well-supported po tayo ng the province of Laguna, the government of Laguna. At yung PDAW po nila nandyan, yung mga ibang municipalities po, nagpadala po ng mga representatives. At pati po yung mga leaders po natin ng Federation of Persons with Disability in Laguna, umattend din po sila. And they are very thankful kasi nga mas naintindihan nila, no, ano yung sakit. Na kasi nga lagi namin sinasabi, hindi lang to sakit sa balat. Hindi lang pwedeng sabihin na balat lang yan. Pero there is more hardships, but there is more, lalo na when it comes to mental health. Diba?
No?
Sige, Coach.
Ayan. Actually, I'm just happy, no, hearing na from Laguna that the PDAW is now supportive of us being PWD. So because like a couple of months ago, before we had this sensitivity training, may mga issues din dyan na ng kuha ng PWD ID. But yeah, so this is just one of the products, no. Unti-unti we'll go there. Buong Pilipinas wala nang ganong hirap na, Coach Bang.
Yeah.
And
we're
so
praying for that.
Claiming on that na. So, ayan, to our viewers tonight, yeah, just please don't forget to comment down below and include where you're from. So, we'll be happy to read your comments there, and let's celebrate itong ating episode tonight by you joining us and, of course, sharing our live as well.
Yun. Pero before we read some comments, ito pala yung mga official hashtags natin, no, hindi natin nasabi kanina. So, hashtag WWP Prostate Cancer, and of course, hashtag Prostate Cancer Awareness Month. Yun. Sige, Coach Alvin, simulan mo ang pagbasa ng ating mga viewers for tonight.
Ayan. So, ayan. Sir Joseph, good evening din. Sabi ni Sir Joseph, good evening mga ka-wellness. Ayan. Na-miss nyo kami, no?
Hello. Good evening.
Ayan. Magandang gabi po sa lahat. Sabi ni Coach Chris, magandang gabi din, Coach.
Para sa'yo tong episode na to, Coach Chris. And from Marie Varias, miss you po watching from Tondo Medical Department of Dermatology and Venerology Online Clinic. Hi, Marie.
Wow. Ayan. Sir, we miss you too. Catch up soon.
Yes.
Like very soon. Ayan.
Yan.
Kabato Ray, one of our allies from Dialysis PH. Magandang gabi din, Ray.
Thank you for watching. Yan. So, siguro, no, again, sa mga baka kakanood nyo lang ngayon, kakalagin nyo lang, our topic for tonight is Prostate Cancer Awareness Week. And this is our 50th episode. And again, just follow this hashtag WWP Prostate Cancer and
And Prostate Cancer Awareness Month.
Yun. Thank you sa pagsalo, Coach. At
Medyo
siguro,
mabigat yun,
wag na natin patagalin, no? Kasi ako, marami rin akong gustong malaman at itanong tungkol sa sakit na ito. Sige, Coach Alvin, please do the honor of introducing our guest for tonight.
Ayan. So, our guest for tonight, no, hindi to biro. The one who will be with us for tonight is actually the past president lang naman ng Philippine Society of Urologic Oncologists. Wow. Ang bigat. And on top of that, he is also right now the vice chair for the Department of Urology at the National Kidney and Transplant Institute. So, without further ado, Coach Pong at sa ating mga viewers, sama-sama tayong matuto. Let's welcome here on our virtual stage, Dr. JV Prodigalidad.
Hi,
Hello, Dr. JV.
Sorry pala, dapat pala President Paul ang tawag sa'yo at saka Coach
No,
Alvin.
okay lang yan.
Nakita ko dito sa comments sabi ko, naku, hindi pala pwedeng basta Paul at Alvin. So anyway, good evening. Good evening everyone. Magandang gabi sa lahat ng nanonood ngayon. Thank you for the invitation and for allowing us to talk about prostate cancer. Sana marami kayong pong matutunan ngayong gabi.
Yes. Actually, last year pa namin gusto i-feature yung prostate cancer, pero wala po kamong contact. And we're very happy kasi po na-connect po tayo ni Miss Menchi with you po para magbigay po itong opportunity to create awareness about prostate cancer.
Yeah, that's good. At least, maraming tao kasi na, well, just a general, pag narinig yung salitang cancer, akala nila mamamatay na sila, akala nila parang they lose hope, wala nang pag-asa, di ba? Pero prostate cancer is a very unique cancer such that mabagal kasi siya Mabagal siya. And since mabagal siya, pwede siyang mahuli na at a curable stage. Okay? Curable. Yun ang medyo iba. Pag narinig mo kasi pancreatic cancer, colon cancer, di ba? Lung cancer, parang some of them, especially pancreatic cancer, mabilis. Pero yung prostate cancer kasi, mabagal kasi yan. It's very slow. So, kung mahuhuli mo siyang maaga and matanggal mo siya, you can actually be cured of it. The slowest cancer, kung sabihin nila, is skin. Okay? Pangalawa na itong prostate cancer. So, ang sana matalakay natin ngayong gabi is how to find out whether you have it. Sino ba yung dapat magpatingin? Sino ba yung dapat magpatingin na maaga? Okay? So, may mga iba-ibang risk factors kasi. So, pag-uusapan natin yan ngayong gabi.
Yun.
Ayan.
Napaka-important yun. Pero, sige, go, Coach.
Sige, Coach.
Ayan. Actually, ito po, super excited lang talaga ako. Grabe kasi every time nga po talaga, Doc, na narinig natin tong cancer, andyan na, hindi na maalis yung kaba. Pero siguro before we continue with what prostate cancer is, ako, I would like to be honest. Alam ko yung term na prostate, but I don't know what prostate is and what are its functions. Baka, Doc, pwede mo kami bigyan ng
Sige. The prostate is part of the reproductive tract ng lalaki. So, lalaki lang ang may prostate. Okay? Lalaki lang ang may prostate. And ang function niya, Ang main function niya is it provides fluid na sumasama sa similya. Okay? So ang similya contains the fluid plus the sperm. The sperm, galing yan sa testicle. Yung fluid na nagdadala ng sperm sa loob ng babae if you're trying to have children, yun yung semen o yung similya. Now, aside from the fluid, may kasama rin yan mga antimicrobials sa semen and other things that make the semen healthy. So yun ang main function ng prostate. Habang tumatanda ang isang lalaki, lumalaki ang prostate. Okay, that's normal. That's not cancer. Okay, yan yung tinatawag na BPH or benign prostatic hyperplasia. Lumalaki yung prostate. Lumalaki siya dahil nagkakaroon ng mga pagbabago sa hormones ng lalaki as they get older. Okay? Kung ang babae may menopause, ang lalaki andropause ang tawag. At ang isa doon, ang isang part ng andropause is yung pagbabago ng hormones kaya lumalaki yung prostate. Okay, now, pag lumaki ang prostate, ang nangyayari sa ibang lalaki, nagkakaroon ngayon ng mga sintomas. So ngayon, kuwari, magsi-CR kayo, di ba? Pupunta kang CR, may kasama ka sa cubic sa mga urinal na medyo matanda. Mapapansin mo, mabagal silang umihi, matagal silang umihi. Ikaw, tapos na. Sila nandun pa rin. Minsan, nakakadalawang palit na yung cubicle o yung urinal, sila nandun pa din. Kasi hirap silang umihi. That's because yung prostate, iniipit yung daanan ng ihi, so nagiging mahirap umihi. Okay? Isa yon. Yung iba, gumigising sa gabi para umihi. I don't know kung ilan dito sa mga nanonood sa atin ngayon. Noong dati, hindi sila gumigising sa gabi para umihi. Pero as they get older, 55, 60, 65, 70, ba't ganun, Dok? Parang ngayon, gumigising na ako 2 beses sa isang gabi. Okay? So there are changes that happen dahil dyan sa prostate. Okay? So, hindi porke prostate, automatically cancer. At hindi porke lumalaki ang prostate, kailangan matakot tayo na cancer. Ang isa pa pala, may mga pasyente, akala nila yung prostate nandun sa scrotum. Okay? Hindi yun kasama sa scrotum. Ha? Ang scrotum, nandun yung testicles o yung bayag. Pwede ba magsalita? Pwede naman, ano? Hindi naman bawal.
Okay naman
diba?
po.
Okay.
Medical term naman siya, Doc.
Okay. So, yung bayag, yung scrotum, which contains yung testicles. So, hindi po yan ang prostate. Kung iisipin nyo, mag-isip kayo ng parang lababo. Yun ang pantog natin or yung urinary bladder. So, may lababo, tapos may drain tayo, di ba? Yung drain ng lababo, yun yung tinatawag na urethra. Doon lumalabas yung ihi galing sa pantog. Now, kung mag-iisip kayo na parang may O-ring o may ring na nakabalot doon sa ilalim ng pantog na ang ginagawa niya, habang lumalaki, iniipit niya yung urethra, yun yung prostate. Okay, yun ang prostate. And this organ, itong prostate, nakakapayan through a rectal examination. Kaya I'm sure narinig nyo na. In the past, meron kami mga tawag dito, may mga activities yung asosasyon namin na sinasabi, DRE mission. DRE stands for Digital Rectal Examination. Na pag sinabing digital, hindi computer. Okay, daliri yon because ang scientific term ng itong finger is a digit. So, digital rectal examination, nakakapa po yan. It's an important test because nakakapa dyan kung malaki ang prostate, nakakapa dyan kung may cancer, nakakapa rin dyan kung may infection. So, that's a very important test na kailangan na isang lalaking ipagawa para to screen for prostate cancer. So, yun. Pero sobra ba? Sobra yata akong daldal eh. Okay.
Okay lang 'yan, Doc, no? Para okay, talagang
malinaw.
Nagkaroon kami ng clear, no? Kasi parang ano nga ba siya? Tapos tapos Doc, kanina medyo nabanggit ko na. Pero aside from cancer, ano pa po ba yung mga ibang pwedeng conditions regarding prostate?
Sige. There are 3 main conditions involving the prostate. Yung una, yung binanggit ko na BPH, which is something that happens to most men, okay, as they get older. pag in-ultrasound sila on executive checkup, sasabihin nila prostate enlargement. Ang normal size is 20 to 25 grams. Yun yung normal for a young adult. Habang tumatanda, lumalaki sila. Pero, hindi dahil lumalaki ang prostate, magkakaroon ng problema pag-ihi. Because there are some men na ang tubo ng prostate papalabas. Remember yung analogy ko dun sa drain na may O-ring? Kung yung O-ring o kung yung prostate palabas ang tubo, hindi niya may ipit yung daanan ng ihi, di ba? So the symptoms won't be so prominent. But malaki yung prostate. So yung iba nagtataka, Dok, ba't ganun? Yung prostate ko, ang laki-laki, wala naman akong problema pag-ihi. Okay, so good, di ba? Yun, yung paglaki. So that's normal. Wala tayong magagawa doon. Talagang mangyayari yan habang nagkakaedad na tayo. Yung pangalawa is what we call prostatitis. Yung prostatitis, hindi madalas marinig yan. It's an infection or inflammation, pamamaga ng prostate. Now, hindi talaga, there are two kinds kasi of prostatitis. Meron yung tinatawag na bacterial and non-bacterial. So yung bacterial, like the term connotes, may bacteria na nagkukos ng prostatitis. Okay? Yung non-bacterial, yun ang hindi talaga malaman kung ano ang nagkukos noon. Maraming nag-research about it for the past 15-20 years. Hindi talaga nila ma-pinpoint kung ano ang cause ng non-bacterial prostatitis. But it does happen. Now, yung prostatitis can happen at any age. The youngest I've seen na may prostatitis, 18 years old pa lang. Of course, as you get older, meron din. Now, how do you tell the difference? Pag kinapa mo ang prostate na benign, okay? Yung benign growth. Parang ganyan. Pag ginanya mo yung fist, ito, pag pinisil mo to, yan ang benign. Okay? Yan ang benign. Pag cancer, ganito, matigas, parang buto. Now, yung prostatitis, parang lamog, parang itong part na to, ng parang mangga na nahulog sa sahig na pinisil mo, parang bugbog. Ganun ang prostatitis. At kapag pinisil yon ng doktor, masakit. So, malalaman mo lang ang prostatitis versus yung BPH or cancer through a rectal examination. Bakit ko nasabi yun? Because the symptoms are almost the same. Whether you have BPH, whether you have prostatitis, ganun din. Humihina ang flow ng ihi, napapadalas ang ihi, parang may natitira. Kasi nga, pag nasasakal yun, iiri yung pantog para lumabas, tapos mapapagod yung pantog bago niya ma-empty lahat, titigil, after a few seconds, may parang second installment para palabasin. Okay? So yun, or nagigising sa gabi. So the symptoms are actually the same. And it's very important for your urologist to find out kung ano talaga yung nagkukos ng symptoms. Prostatitis ba yan? BPH ba yan? Because the treatment may vary. Okay, so and the third condition, obviously, yung prostate cancer. Yan ngayon, it's the number 3 cancer among men. Okay, doon sa recent survey. Number 3 siya among men. Nag-lecture ako niyan last year. Noong 2005, I think it was number 4 in the world. Ngayon, number 3 na siya in the world. Okay, so dumadami ang tumataas ang rank ng prostate cancer in the world actually. Yan. So yun yung tatlo na condition na tungkol sa prostate.
Thanks, Doc.
Thanks, Doc, no? Grabe. Yan, nalinawan na tayo na the symptoms may be similar, no? Pero ayun nga, only doctors can tell. So, Doc, bago tayo pumunta kung paano ba madadiagnose or what, paano po ba or what causes these prostate disorders or conditions?
Okay. Ang isang bad news dyan sa prostate cancer is that the risk factors, the basic risk factors are things that we cannot control. Dalawa yan. Yung una is advancing age. Habang tumatanda, ang isang lalaki, tumataas ang risk for prostate. So, unless isa sa atin makadiscover ng fountain of youth na hindi tayo tatanda, you will always be at risk as you get older. Okay? The second risk factor is family history. So, if you have lalo na kung first degree relative, father, brother, or even second degree, meron pa rin, may risk pa rin yan. Uncle, grandfather, pagka may family history ka ng prostate cancer, the risk of you getting prostate cancer is much higher. It's almost 3 to 5 times higher than the person who does not have prostate cancer. Now, there are different secondary risk factors na kung sabihin nila, and one of them, for example, is yung dietary fat intake. So when I say dietary fat intake, hindi ko sinasabi na pag kumain ako ng lechon ngayon, tataas yung risk factor ko for prostate cancer. It's usually a lifetime of dietary fat intake. Bakit nila nasabi yon? Kasi before, when studies were being made dun sa incidence ng prostate cancer worldwide, nakita nila na ang prostate cancer mataas sa mga bansa na mataas ang dietary fat intake. So back in the 50s or maybe up to the 60s, the Eastern world, tayo mga Orientals, Japanese, Filipino, mga Asians, mas mababa ang ating risk for prostate cancer as compared to the Western countries. Unfortunately, nakikita natin ngayon, di ba? Ang daming fast food chain. Yung ating lifestyle ngayon, yung ating diet na yon, para na rin sa Western world di ba? So, sinasabi nila na that's one risk factor and that can be one of the possible causes kung bakit ngayon tumataas na ang incidence ng prostate cancer. Okay? Another one na nagsasabing that can put you at risk, obesity. Okay? So, pagka overweight ka, you're overweight, you're obese, it puts you at risk. Of course, other vices then are said to be secondary risk factors. Smoking, alcohol, mga ganun ba, lack of exercise, a sedentary lifestyle. So basically, keeping your lifestyle healthy helps reduce the chance of getting prostate cancer or any cancer in general. Yun. So yun yung mga risk factors. So yun nga, very, very that's what's very, very sad about it, na hindi mo siya makokontrol, di ba? So swerte tayo, mabagal siya. It's something that's really slow. Pero wala tayong magagawa really para iwasan siya. So kung hindi natin siya may iwasan, then the only way to make sure na you're okay is magpa-screen ka. Yun, magpatingin ka, magpa-check ka. Yun.
Yeah. Before we continue, Doc, may phone-in question kami from one of our viewers, from Joseph. Sabi niya, may age ba ang lalaki na mas at risk siya sa prostate cancer? Or
well, wala talagang specific age, but yung screening for prostate cancer starts at 50 years old. Okay? Dito sa 50. Pilipinas, the Philippine Society of Urologic Oncologists would advise patients, the general population, to get themselves screened by the age of at the age of 50. Now, if you have family history of prostate cancer, yan ang medyo mas maaga ka. Sinasabi namin by 40 years of age, dapat magpa-screen ka na. Kwento ko lang, meron ako isang pasyente dati, doktor to. When we diagnosed him, he was around 78. Nasa ganun age, 78, may prostate cancer siya. Okay, so dahil nagka-prostate cancer siya, sabi namin doon sa anak niya na rin na doktor, na bata pa, nasa mid-40s pa lang, sabi namin, magpa-check ka na rin ng for prostate cancer, yung blood test, yung ganyan. Alam nyo, mas malala pa yung cancer nung bata, nung anak, kaysa dun sa father. Yung bata, kalat na. Yung dun sa matanda, hindi pa. So, very talaga yung family history, and may mga studies na nagsasabi na yung inherited or yung genetic na prostate cancer, yung namamana, mas aggressive siya kaysa dun sa magulang. So, talagang very important yan na So, 50 years old for the general population, 40 years old for those with history of prostate cancer in the family.
Thank you, Doc, for that. Tapos, sige, Coach Alvin, next question tayo.
Ayun, Doc, no, since nabanggit mo na yung normal, like kung kailan dapat magpa-screen no, in general. Well, sabi mo nga, it could be kasi Doc no na genetic siya pero hindi I mean namana natin siya pero hindi natin alam kasi hindi rin na-trace sa ating mga ninuno pa.
Correct.
So, Doc, about that kasi na-explain mo na rin kanina that there are other what do you call this? Prostate conditions or disorders
Yep.
na other than prostate cancer. So, ano po sa tingin mo, Doc, no? What are the symptoms of prostate cancer or let's say yung symptoms na distinct compared dun sa ibang na-explain mo na kaninang prostate disorders?
Okay, yan ang problema, okay? Let's get medyo scientific ng konti. The prostate is divided into two areas. You have what we call the peripheral zone, yung labas ng prostate, and you have the transition zone, yung gitna ng prostate. So remember yung binanggit ko kanina na yung daanan ng ihi, dumadaan siya through the prostate, di ba? So, madalas nagkaka-symptoms yung benign kasi yun na nasa gitna, yun na nag-iipit sa urethra. Ang prostate cancer, because it comes from the peripheral zone or sa labas, pag tumutubo yan, wala kang symptoms. So, maaaring meron ka ng prostate cancer na early or localized prostate cancer na wala kang nararamdaman. Walang problema pag-ihi. Normal na normal. Tapos pagka nagpa-check ka, doon mo lang malalaman. Okay? Nagpa-check ka nagpa-screen ka, that's the only time na you find out na you have prostate cancer. That's why it's very important If a patient or a man has symptoms because of prostate cancer, that means that the peripheral zone, yung pinagmumulan ng cancer, sa sobrang laki na ng cancer, naipit niya yung daanan ng ihi. And so kung sabihin nila, pagka yung symptoms galing sa prostate cancer, usually that's a sign of more advanced disease. Kasi naiipit na niya yung daanan ng ihi. So, again, maybe I guess kaya ganun Coach Alvin na very important magpa-screen because basically early prostate cancer has no symptoms at all.
Tapos, Doc, besides the screening, how do you usually diagnose?
Okay.
Or paano mo mako-confirm na this is prostate cancer?
Sige. Let's do it stepwise. Okay, let's do it stepwise. Let's say, may lalaki, 55 to 60 years old, sabi, pupunta sa doktor, gusto magpa-check. Okay, Doc, gusto ko magpaano for prostate cancer. Paano ko ba malalaman kung meron akong prostate cancer? Wala. So there are two tests, two screening tools. Yung una, na gagawin ng urologist nyo sa clinic is a rectal examination. So yun yung dinescribe natin kanina, nakakapain yung prostate nyo, titingnan kung meron matigas, okay, kung meron matigas, then that's suspicious for prostate cancer. Pero let's say wala naman. Okay, walang matigas, walang prostatitis, then everything is fine. Okay, walang Okay. The second test na gagawin yung tinatawag na PSA. PSA is a blood test. It stands for prostate specific antigen. So, any problem with the prostate will cause a corresponding increase in the PSA. Now, ang normal value ng PSA is 0 to 4. Okay? 0 to 4. Pagka lumampas ng 4, it doesn't mean may cancer ka na. Okay? It just means na yung doctor mo has to try to find out bakit medyo mataas yung cancer, yung PSA mo. Let's say, PSA 7. Okay? So mataas yun. 0 to 4 ang normal. Tapos pagkapa ng prostate, meron palang prostatitis. Pag pisil lang ganun, masakit yung prostate. Sabihin ng doktor, alam mo, maaaring kaya mataas ang PSA mo kasi may prostatitis ka. So gamutin ka muna natin, bigyan kita ng antibiotic, bigyan kita ng pampaluwag ng ihi. After magamot natin yan, tignan natin kung bababa ang PSA mo. So ito na, uminom na yung pasyente ng gamot. Okay? Tapos after 1 month, balik siya. O Doc, okay na yung pakiramdam ko. Okay? Kinapa ng doktor, wala nang masakit. Okay? So wala nang masakit. So wala na, nagamot na yung prostatitis niya. You will expect the PSA to go down. Diba? Kasi ang iniisip natin, kaya mataas yung PSA dahil sa prostatitis. Diba? So, Papagawa ka ngayon ng PSA. Kung bumaba siya sa normal, edi okay. Di ba? Alam mo na kaya tumaas yung PSA niya at that time was because of prostatitis. Pero kung hindi bababa, let's say from 7, naging 6. Okay? From 7 nanograms per deciliter, naging 6 siya. Ngayon, sasabihin ng doktor, okay, mataas pa rin ang PSA nyo. Doon na kailangan mag-investigate. And there are different ways to investigate. Dati-rati, pagka mataas ang PSA at wala kang explanation, ang ginagawa namin, binabiopsy namin yung prostate. Yung biopsy is conducted by inserting a needle through an ultrasound probe into the prostate. So, marami nagtatanong, baka pag biniopsy yan, Dok, kumalat na yan. Pag sa kakatusok mo, kumalat na siya. Actually, hindi. Kasi ang prostate, makapal ang kanyang tinatawag na capsule, okay? Para siyang santol. So kahit tusukan mo ng karayom, paglabas ng karayom, magsasara yun. Okay? So hindi yan kakalat, hindi yan yung sinasabing gigisingin mo, yung cancer, hindi ganun yon. And it's the same everywhere around the world. It's the same technique na ginagawa. Okay. So iba-biopsy mo ngayon yon. Pag lumabas sa biopsy na may cancer, then it's confirmed. Diba? Pag lumabas sa biopsy na walang cancer, then at the moment, you can say na walang cancer. Okay? So, babantayan na lang natin yung PSA nyo, titignan natin kung tataas pa yan through the, after every 6 months, kung tumataas yung trend, you may need another biopsy, okay? To find out kung tumataas ulit, you may need another biopsy to confirm. Kasi baka mamaya, pag biopsy mo, maliit lang pala yung bukol, tapos hindi mo natamaan. Ang isang mahirap kasi sa prostate cancer, on regular ultrasound, 50% of cancer lesions can be missed out. Okay? So, it doesn't mean na just because, yung ultrasound ng prostate, wala naman nakikitang bukol. It doesn't mean na wala ka ng cancer for sure. Kasi nga, 40 to 50% of cancer lesions will be missed out. Now, yun ang routine way of diagnosing prostate cancer. And yun ang nasa guideline. Okay. Ngayon, lately, over the past maybe 5 years, merong bagong paraan ng pag-diagnose ng prostate cancer. And this is what we call yung MRI or magnetic resonance imaging. So MRI siya of the prostate. A specific term para dun sa test na yon is called the multiparametric MRI of the prostate. Now, what's the difference? Yung multiparametric MRI of the prostate is up to 70 to 90% accurate in determining kung may bukol sa prostate na nagtatago na maaaring hindi mo makapa, hindi mo makita sa ultrasound. Okay? So, unfortunately, sa Pilipinas, hindi lahat ng lugar may multiparametric MRI. Yun ang pagkukulang natin. At this point, I'm sure later on, sigurado yan, dadami yan. Okay? Pero at this point, medyo kulang. Dito sa Manila, Metro Manila, marami. In big centers, in the Philippines, big cities in the Philippines meron, pero let's say pupunta ka sa probinsya, okay, na hindi ganun ka high-tech ang mga ospital, maaring wala. And so they still rely on the conventional way of diagnosing prostate cancer. Pero yung MRI kasi, sa sobrang accurate niya, pag sinabi ng MRI, wala kaming nakitang lesion, yun na yun. Kahit gaano kataas pa yung PSA, 7, 10, pag sinabi ng MRI, wala, you don't biopsy. Pero, minsan may makikita sila maliit. Okay? At pag may nakita sila maliit na nodule, meron na rin ibang mga center dito sa Metro Manila na kayang i-target yung maliit na yan. Yung isang nagawa kong pasyente, ginamitan ko yung particular machine na yon, yung MRI ultrasound fusion biopsy. Ang bukol ng pasyente ko, 0.3 cm. So 3 millimeters, parang munggol lang yan, di ba? Parang munggol lang yan. Pero because of that machine, natatamaan mo siya. At yung lumabas doon sa pasyente ko na yun, cancer, early stage cancer. So, naoperahan yung pasyente, natanggal yung prostate. Now, ang PSA niya, 0. So, that's what you call cure. Cure na yun, 0. Tinanggal mo na lahat, walang natira. Of course, babantayan mo pa rin yun, pero yun yung sinasabi ko na sayang kasi wala pa talagang MRI all over the country. But eventually, maghantay lang tayo. I'm sure, di ba? I'm sure magkakaroon din yan. So those are the two ways of confirming whether you have prostate cancer or not. Still through a biopsy, yung to confirm. Yun.
Ayan. Thank you, Doc. No? Gaya nga ng sabi mo, no, hopefully, sabi mo, since available na siya, Doc, sa bigger cities natin here in the Philippines. So, hopefully, no, maging available nga rin siya across the Philippines talaga. So, Doc, kanina nabanggit mo na to kanina pa, yung the prostate cancer is one of the slowest cancer. And based nga dito sa nabanggit mo na rin na what do you call this, experience mo with one of your patients na gamunggo lang yung laki ng bukol. So, parang it seems like ganun talaga siya kabagal, no? Pero you were able to at least address that, no? At sabi mo nga, cancer-free na. Pero Doc, sa type ng cancer na ito na medyo mabagal yung pag-progress, paano ba natin natutukoy yung antas or yung stage na ng prostate cancer? And how does it affect then, Doc, yung pagpili ng tamang treatment for this cancer?
Okay, all cancers, they all have different stages. Yung mga definition ng stage 1, 2, 3, of course, mag-iiba yon for the different cancers. Pero yung stage 4, I'm sure medyo familiar na kapag sinabing, ay, stage 4 na yan stage 4 na yan. Diba? Ibig sabihin nun, lumabas na siya dun sa kanyang natural organ at kumalat na siya. Okay. So, yung staging ng prostate cancer starts with the diagnosis of prostate cancer. Okay? Ang prostate cancer, pag na-diagnose sa isang tao na may prostate cancer, is divided into two categories. Meron yung tinatawag na low risk at yung high risk. Now, yung pag-define ng low risk, high risk, that will depend on the biopsy. May mga cells silang hinahanap sa biopsy na magsasabing, itong mga characteristic nitong cells na to, low risk to, itong characteristic na ganito, high risk. Now, bakit siya importante to differentiate between low risk and high risk? Because yung low risk prostate cancers, are slower, and so your treatment options are different. Pagka high risk ang prostate cancer, mas aggressive sila. So ang tendency mo is you do more. So yung kumbaga, let's say, pag high risk prostate cancer for example, na hindi pa kumakalat sa we're just talking about stage 2, yung medyo nandun pa lang sa prostate. Localized prostate cancer, hindi pa siya kumakalat, hindi siya lumalabas, pero high risk based on the cells. Okay. So let's say, localized prostate cancer, nasa prostate lang, high risk siya. The recent studies have shown na mas makakabenepisyo ang pasyente kapag yung mga high-risk cancers na yan, niradiate mo at binigyan mo ng gamot to control the testosterone. Dati-rate, basta basta localized prostate cancer, automatic yan, option ang surgery. Pero ngayon, latest data over the last 3 years worldwide will show na mas matagal mag-progress at mas mahaba ang survival kapag itong mga pasyente na to is in-address with radiation and hormonal treatment. Okay? Pagka localized naman na low risk, yan ang mga amenable or to do surgery or aalisin mo yung prostate. Another factor to consider with treatment is yung general well-being ng tao. Ang tinitingnan namin, more than age, is yung tinatawag na life expectancy. Yung life expectancy, there's a way to calculate for that depending on the status of the patient, his functional status, his mga what we call comorbidities, meron ba siyang uncontrolled diabetes, uncontrolled hypertension, chronic renal disease. So, kung ang pasyente mo may 10 to 15 years life expectancy, ibig sabihin relatively healthy, you expect him to live 10 to 15 years, you want to do something that's more aggressive. Why? Because yun ang kumbaga, you want the gold standard. So the gold standard is surgery. Tatanggalin mo yung prostate. So if I have a 65-year-old patient, relatively healthy, with a good 10 to 15-year life expectancy, we would probably offer surgery because yun ang gold standard. Studies are, yung kumbaga, doon pinagbabasihan yung ibang treatment. Kasi yun ang pinaka-gold standard, yun ang pinaka-alam na makakagamot o makaka-cure sa prostate cancer. Okay? So, nag-iiba-iba. Ngayon, let's say, kumalat na siya. Okay? Meron sa buto, or maraming lymph nodes, mga kulane sa tiyan. Hindi mo na yun operahan. It's useless to operate because nasa dugo na kumalat na. So kung nasa dugo na ang prostate cancer cells, kailangan mo rin ng treatment na nasa dugo. That's what we call systemic treatment. So yung systemic treatment is composed of injections, quarterly injections or every 6 month na injections, which acts to control the prostate cancer cells by killing your testosterone. So, ang ginagawa ng mga injections na yon, pinapatay yung testosterone in order for the tumor cells to be rendered inactive. The fuel for prostate cancer is testosterone. So, basta't may testosterone ka sa katawan, yon ang magpapalaganap ng prostate cancer. And that's why these injections that suppress testosterone are able to control these prostate cancer cells. Ang isang, if you want to call it maganda na balita, with prostate cancer, regardless of what stage you are, localized, locally advanced, metastatic, meron mau-offer kahit papano. And it helps slow down the progression and it helps alleviate symptoms, lalo na yung mga nasa buto. Kasi yan, minsan may mga pasyente, papasok sa clinic namin, sumasakit yung likod, tapos pag PSA mo, 200, 300, o tandaan mo, 4 lang ang normal ha. So 200, 300, tapos pagka binone scan mo, kita mo, kumalat na siya sa buto. Pag nag-umpisa ka nitong mga injections, they really feel better. For a time, you can control them so you can improve their quality of life. So, yun lang ang siguro the good side of prostate cancer. Meron ka talaga mau-offer. Meron kami mau-offer for any stage of the disease.
May follow-up question ako dyan, Doc. Kasi sabi nyo nga, the screening is 50. Tapos, usually, older, pag advance yung age, usually parang doon nagkaka-prostate cancer. The question is, kasi nga, in-offer nyo po yung merong mga may surgery na option, may treatment, hormonal treatment, or may radioactive na treatment. When it comes to, kunyari, senior na po, what is ideal treatment?
Okay.
I mean, parang, from a point of view na, paano nga po kung ganon? Kung matanda na, baka siyempre may touch tayo na baka manghina na, hindi kayanan kung isa-surgery. Pero pero if that's what's needed naman, so how do you explain it, Doc?
Okay,
yung mga
ganito,
options na ganun.
Ganito. I mentioned surgery because that's the gold standard. Now, there are other options. Para sa mga pasyente who are older, who cannot withstand surgery, minsan kahit na 70 years old lang siya, 65 years old lang siya, pero ang sama ng puso, hindi kaya magpa-opera, di ba? Merong ibang options. For example, radiation. Okay? What they do is, nire-radiate nila yung prostate para mapatay lahat yung tumor cells. Okay, that's an option. So, compared to the gold standard, which is surgery, actually, yung mga data, halos hindi masyado nagkakalayo. Mas maganda pa din, based on the studies, mas maganda pa din yung surgery for the right individuals, yung tamang mga tao. Pero yung radiation, hindi masyadong nalalayo. So, kung ang pasyente, hindi pwedeng maoperahan or ayaw magpa-opera. Okay, meron akong pasyente dati na isang military person na he was for promotion. Malapit na siya mag-retire. Gusto niya magpa-promote as general. Okay, this was a long time ago. Magpa-promote as general. Ayaw niyang malaman ng mga tao na meron siyang prostate cancer. Okay? Ayaw niya magpa-opera kasi malalaman din, di ba? So, niradiate namin siya. And right now, yung PSA niya is still 0 and it's been 12 years. 12, 13, 15 years. So meron naman mga option talaga. And again, yun ang isang maganda sa prostate cancer. You have options. Whether hindi ka pwede magpa-opera or ayaw mo magpa-opera, may mga option naman na ma-offer. So I hope that answers your question. At yung radiation ngayon, hindi kamukha yung mga radiation dati, yung cobalt na kung tawagin, yung cobalt na parang di ba? Pagka ni-radiate mo, let's say yung mga mga ovarian cancer or yung susunugin lahat ng dadaanan, hindi na ngayon ganun.
Yeah.
Hindi na ngayon ganun. So there are less toxic ways to deliver radiation. Ang galing, parang wala sila masyadong nararamdaman. So, marami talagang advances ngayon na makaka-benefit sa mga pasyente na may prostate cancer.
Tapos, Doc, isa pa, based on your explanation kanina na one of the drivers of prostate cancer is testosterone. So, may sinasabi po kayo na parang treatments to lessen.
Yeah.
Parang may gusto ko lang yung options pa na iba, sir, na kasi di ba yung iba minsan parang alisin na lang natin yung testicles para wala na yung testosterone versus kung ititreat mo lang o ilalessen lang yung hormones of testosterone. Pwede po bang pa-explain yung ganong aspect, Doc?
You know, that's a very, very good question. Dati-rate, maybe 20, 25 years ago, wala pang masyadong injections to control testosterone that were very, that didn't have very bad side effects. Nung residente ako in the mid-90s, yung mga binibigay na gamot to control testosterone, sobrang toxic. Cardiac-wise, nagkakaroon ng mga problema sa puso. Talagang sobrang So, ang ginagawa namin before was to take out the testicles. Ang tawag doon, bilateral orchiectomy. Tatanggalin mong pareho yung testicles. And especially for patients before na hindi naman kayang bumili ng gamot na magpapadiba. Kasi lifetime yan eh. Lifetime yan. So hindi nila kaya bumili ng gamot. The option is to take out the testicles, okay? We still do that. For example, at NKTI and other government institutions because hindi naman namin pwedeng ipilit dun sa mga pasyente namin kung hindi naman nila kaya talaga, di ba? So you have to do the next best thing. Pero we try not to because may mga study na nagsasabi na pag tinanggal mo yung testicles as compared dun sa injections, okay, yung mga injections, mas napapabilis yung mga side effects ng castration, kumbaga. Kasi yung pagtanggal ng testicles, surgical castration, yung injection is medical castration. So yung surgical castration, pag ginawa mo yun, mas mapapaaga yung mga side effects. Osteoporosis, yung mga ganyan. So we try not to do that in order to avoid the medical side effects of castration. So yun ang isa. Kaya even around the world, hindi sila masyadong pabor na dyan. But then, around the world, di ba, lalo in Western countries, patients don't have to pay 100% for their medications. Right. So, kayang masustain. Pero tayo hindi. Pero you're right, tama. Kaya hindi natin ginagawa yun. We try not to. But that is a solution, and that was the solution before. Tama. Ay, just one thing. Baka naisip nyo, baka may mag-isip dyan, sige, what if alisin ko lang yung testosterone ko para hindi ako magkaroon ng prostate cancer? It doesn't work that way. It doesn't work that way. Naisip ko lang ngayon eh. Because the side effects ng medical or surgical castration, okay, kung wala ka talagang established prostate cancer, that means wala ka talagang na-establish na benefit, di ba? Puro side effect lang
Mhm.
Of course, if you control your testosterone early on, then mapapatagal siguro, nalalabas siya. Pero my God, yung naman side effects niya, sobra naman compared to sa benefit. So we also don't do that because it's not going to be beneficial for the patient.
All right.
And thank you, Doc, no? And yeah, it actually just shows, no, Doc, and sa mga viewers, treatment for prostate cancer or any other condition is always personal. So, ayan, lagi po tayong magpakonsulta, pinapaalalahanan po namin kayo. Wag po tayong magsa-self-medicate lalo na sa mga ganitong condition. And always seek the best advice from your doctor. You can always tailor fit or paano ba? I-personalize yung mga gamutan kung ano ba ang bagay sa iyo at ano ba yung kaya ninyo. Ayan, Doc, we're actually through with the scientific side. This is still scientific pero with a touch of a lot of myths na ano. Marami kasi growing up, no, marami akong naririnig about prostate cancer, sinasabi ng mga matatanda na isa po dito, Doctor, siguro let's talk about what are the myths or misconceptions about prostate cancer. So, growing up, may mga naririnig ako, sabi, those who are cycling a lot is prone to it. May sinasabi din sila na kapag nagkakaroon ng physical trauma excuse me for the term, we're all adults here, at sa mga may batang nanonood, patnubay ng magulang ang kailangan.
Ganun lang tenga nila.
Ayun po. Kapag nagkakaroon po ng trauma sa bayag, that it triggers or it contributes to having prostate cancer. Doc, can you help us clear out kung ito ba ay myth or facts about prostate cancer?
Okay. Yung trauma sa bayag, hindi. Because like we described earlier, wala naman yung prostate dun eh. Diba? It's not even going to hit the prostate. Okay? So that's not true. Okay? Ano yung una mong question? Yung sabi
about
mo
cycling.
Yung sa cycling daw, Doc.
Oo. Yung cycling, if you sit on the saddle, the area that touches the saddle is your prostate. And for those here na nagsa-cycling, alam nila na yung mga upuan nila may parang groove. Diba? May mga groove yun eh. And that groove is made there para hindi masyadong tatama yung prostate dun sa ano na yon, dun sa area na yon. It does not cause prostate cancer. What I see as a result of that is prostatitis. Nabubugbog kasi gumaganyan yung prostate nila on the saddle. And even some patients will say, pero yung upuan ko, yung maganda yung butas na yon, yung ano na yon, yung groove na yon. Ang sasabihin ko, okay, can you assure me that every time you hit the saddle, dun talaga eksakto tatama? Hindi naman ganun yun, di ba? Lalo na kuwari yung trail, di ba? Tapos tatamang-tamang ganun, di ba? Hindi naman maasinta yun. So, it doesn't lead to prostate cancer. Trauma doesn't lead to prostate cancer. Trauma can lead to prostatitis. Meron pa iba. Uunahan ko na kayo. I'm sure may mga ano na yan. May natatanong ako niyan eh, mga ibang matatanda. Doc, sabi mo na nga, adults naman na tayo dito, di ba? Doc, pagka oversex ba or undersex, mas magkakaroon kang prostate cancer? Okay. Ang tamang sagot dyan dapat walang kinalaman. Bakit ko sinabing dapat? Okay? There was maybe one or two studies. I don't know kung nakita nyo to, pero years ago lumabas yan. It's supposedly from Harvard Medical School saying na in order to reduce the risk for prostate cancer, kailangan magpalabas ng similya 21 times a month. Nandiyan yan. I-google nyo yan, makikita nyo yan, study na yan. But, to be honest, I don't know how you can really predict that, di ba? Yung bang mga nag-sign ng survey na yan, honest ba silang ganon? I'm not questioning the study, but when you think about it,
Right.
parang everything else, all the other studies that had been established, walang nakikitang correlation. Okay? And then you have one or two studies. Okay, so Of course, kung gusto niyong gamitin yan, Alvin or Paul, para dahilan niya sa mga asawa niyo para sabihin gusto niyo umiwas sa prostate cancer, pwede niyong banggitin yon. Okay, but what I would say is siguro have a healthy, regular sex life. And what is regular? Kung sabihin nila once a week, twice a week. Okay, of course, as you get older, it can slow down. Yung mga pasyente ko na pare, tinatanong sa akin yan, I just assure them na it's not really an established risk factor na pag wala kayong sexual activity, magkakaroon kayo ng ganyan. Yun. So, yan yung mga myth. Ano pa yung mga myth? Yung kung wari, yung kasi sinabi ko kanina, pag ginalaw yung prostate, kakalat yan dahil tinusok, hindi naman po totoo yan. Hindi yung totoo. Meron pa kayong gustong tanungin na myth na alam nyo? Ano
Actually,
pa?
Doc, yes po, may tanong ako. Ito naman po for our friends and viewers from the LGBTQ plus community,
Okay.
especially for the trans woman,
Okay.
especially those who are taking pills.
Okay.
Doc, may impact din po ba ito in possibly having prostate cancer?
Okay. If ever that subject of patients, that subset of patients, it will not increase your risk for it. I don't think it will increase the risk for it. However, it may be difficult to diagnose it because it may alter your PSA. Okay? It may alter the results of the examinations. So yun. So yung risk per se, I don't think it's going to increase it. But it's the ability to diagnose it that might be a little affected by it.
Thank you so much, Doc. Ang dami, ako, yun yung mga narinig ko about prostate cancer. Ikaw, Coach Pong, baka you have anything to ask?
Sa akin wala namang parang ibang mix yung side na anuhin ko na misconception. Lalo na when it comes to screening, Doc. Kasi syempre, for men, syempre, it's rectal examination. And mostly kaya konti lang nagpapaskin kasi they might find
Ayaw
it
nila.
weird, di ba? Kasi parang, iba, parang baka matapakan ba yung pagkalalaki nila or what? Or is it something weird? Ano yung masasabi niyo, Doc, na how can we do or encourage men to do the screening and
Okay.
para
unfortunately, ganito yan. Unfortunately, the rectal examination is really an important tool. Of course, short of doing an MRI, it's a very basic and important tool. Hindi siya actually masakit if it's done properly. Kasi what the doctor is supposed to do is to put a lubricated, gloved finger, press on your anus, and allow the anus to relax bago ipasok. Okay? Of course, it's not comfortable. You'll feel para kang nadudumi, ganyan. Di ba? Hindi tayo sanay nung ganun di ba? But it's not supposed to be painful. And if you have your apprehensions, just remind your doctor, Doc, first time ko pa lang, baka masaktan ako, please be slow, please ganyan. And the doctor will do it naman But the benefits that you can get from having that rectal examination are so much. Okay? Sobra. For example, let's say, ito na lang example, let's say mataas ang PSA nyo. Sabihin nyo, Doc, huwag nyo na ako i-rectal exam, biopsy nyo na lang. Kung gusto nyo, huwag nyo na i-rectal exam. Yung biopsy mo under anesthesia. Okay. So now, yung doktor, hindi niya ma-rectal exam, sige, binayopsy niya. What if ang dahilan pala ng pagtaas ng PSA is an infection of the prostate? Diba? So ngayon, you have an infected prostate, tinusok-tusok mo ngayon yan, kakalat ngayon yung infection. Okay? And so that's one of the advantages of doing the rectal exam. You can make sure na walang active infection yung prostate. So it's very important in the US, before, they were trying to minimize the biopsies by removing the PSA as a screening tool because sabi nila sa kakabiopsy, nagkakaroon ng mga complications. Pero I think if you prepare the patient well, kinapa mo, alam mo nang walang infection, okay, bago mo tusukin, then actually ma-avoid mo yung sinasabi ng mga complication niya. So to the viewers now na takot magpa-rectal exam, please huwag kayong matakot kasi yun talaga basic yan. PSA at saka rectal exam, yan po ang basic. Sayang naman po kung hindi kayo ma-screen because of that fear, because like I said, no, prostate cancer is very slow, and if you've been listening since kanina, makikita nyo na every stage of the disease meron ma-offer, 'di ba? And sayang lang, 'di ba? Kung hindi ka papayag because of a fear that you may have.
Right.
Yes. And yeah, Doc, thank you, no? Well, siguro, Coach Pong, siguro sa perspective natin as patients na rin, well, it's not cancer, but we've been living with our condition for quite some time. So, siguro, we can always encourage ourselves na mas mahirap yung may sakit
Yeah.
kesa pagdaanan yung screening process na to.
Yeah, at saka yung rectal exam, usually ang takot ng mga pasyente, yung first. And that's why also, yung mga kasama kong doktor, is very important to make that first experience, how do you call it? Parang hindi traumatic. Okay? Meron ako isang pasyente na nagpa-screen sa akin, ayaw niya magpa-rectal exam kasi daw na rectal exam siya dati, sobrang sakit. Parang ang ginawa ng doktor, basta pinasok ka agad yung finger, masakit talaga yon. Kasi hindi pa nag-relax yung butas ng puwet, pinilit eh. So I had to, alam mo, it took me 10 minutes to convince him, 10-15 minutes to convince him. Then eventually pumayag siya, tapos sabi niya, pwede naman pala Dok, hindi masakit eh. Okay? So very important yan because kapag yung first experience nung pasyente hindi maganda, hindi na yan babalik. Sayang, di ba? Sayang.
Tapos may follow-up question ako, Doc. Since nandun tayo encouraging everyone to do the screening. From Joseph Paulet, what are some proactive steps that men can take in their daily lives to reduce the risk of developing prostate cancer and promote overall prostate health?
Okay. The risks, okay, remember we mentioned earlier na there are risks na wala tayong control, di ba? Yung age at saka family history. But there are other lifestyle changes or lifestyle behaviors that you can adapt, okay? First is what you eat. We mentioned earlier dietary fat, so you try to reduce your fat intake, eat more fruits and vegetables, okay? May mga nagsasabi na green tea can help. It helps reduce the PSA daw in those patients who are high risk. So green tea is one. Meron pa yung avoid eating yung charred na meat, mga steak. I'm not saying don't eat it. I'm just saying na you try to in moderation. Lahat naman, di ba? Lahat naman yan in moderation eh. Okay? So aside from the diet, try to keep a healthy weight. Okay? As I mentioned earlier, one of the risk factors is obesity. So you may want to watch your weight, get regular exercise. Exercise not only for prostate cancer, it's also for your heart. And it's been established that if you exercise, it supposedly builds your immunity and helps battle any cancer. So yung exercise is very important. Some would also say avoid yung mga smoking and alcohol intake because that can also worsen or decrease your immune system and make you susceptible to other cancers. One vitamin that's said to have a role now coming up with parang sa risks ng prostate cancer is vitamin D. So get vitamin D as in dog. Right now, yung mga endocrinologists, internists are very conscious of that. There's actually a blood test for that, yung vitamin D. So if you have a good level of vitamin D, they say that it can reduce the risk for prostate cancer. Saan ba natin nakuha yung vitamin D? Di syempre sa araw, di ba? So get some exercise, go under the sun. Sana yung mga tao na parating nakakulong sa laptop nila or device nila, di ba? Yung mga bata ngayon, hindi sila lumalabas di ba? So yan, lumalabas, dapat get some sun and stay sexually active. Because yung sexual activity, like I mentioned earlier, kung tama man yung Harvard study na yon, then but stay sexually active. It helps you also. It keeps your prostate healthy by ejaculating regularly. Every time kasi na magpalabas ng similya ang lalaki, ang nagpapalabas actually doon are the prostatic muscles. So when you ejaculate, pag ganun yun, magko-contract yun para mapalabas yung similya. So it helps keep the prostate healthy. So in general, whatever is good for the body, whatever is good for your health in general, yun din ang sa prostate cancer.
Ayan. Thank you, Doc. And for sure, iiwasan ko po yung obesity. And yeah.
Hindi ako nagpaparinig. Wala pa ang tinatamaan pa sa inyo.
Tinamaan po talaga ako.
Natatakban ko yung side nyo para gano'n.
Tinamaan po talaga ako doon, Doc. Pero buti na lang na kontra po nung pagpapaaraw. Pero kidding aside, Doc. Since nabanggit natin itong proactive steps. So, proactive steps din actually is part yung screening, no? So, Doc, kasi kanina when I introduced you, you were the past president of the Philippine Society of Urologic Oncologists. Now, I'm not pretty sure here in my province of Pangasinan if we have urologic oncologists, but I know that we have hospitals here na may mga urologists. So, pwede po ba or sila po ba ay isa rin sa mga doctors na pwede naming puntahan for screening, or sino po ba or saan po ba dapat kami magpa-screen or if we are interested?
Okay, ganito ha. Screening is usually done by your urologist. Your internists, may opt to have you do the PSA. Okay? Kasi yun ang gagawin nila . You can't expect your cardiologist na mag-rectal exam sa inyo, di ba? So lalo na kung babae cardiologist, huwag kayong magpapascreen. Doc, i-rectal mo ako. Hindi, syempre hindi lang gagawin yun, right? Pero they can do the PSA. They can order for the PSA. And if your PSA is normal, sometimes they'll say, okay na yan. Okay, but you have to remember, there are patients who have a normal PSA and still have prostate cancer. Okay, in around 5%, 5 to 8% of cases, normal PSA, meron pa rin prostate cancer. Lalo na yung mga high risk, the one I was mentioning earlier, high risk prostate cancer, those kinds of cells do not secrete as much PSA. So their PSA levels may not be as high as the low risk. Okay, so it's very important to have yourself screened. So you go to your urologist. In most provinces, may mga urologists. There are now, if I'm not mistaken, around 350 to 400 urologists all over the country. Pangasinan, meron. I know of several sa Dagupan. Okay, yes. There are urologists there. You just say papascreen ka, lalo na yung mga tao na may family history. Very important 'yan. Okay, na magpa-screen. And yun, that's how you get going. If your urologist says you're fine, then okay, you're fine. Yeah.
Tapos, Doc, since we're talking about where to do the screening, how about when it comes to treatment naman, Doc?
Okay.
And meron po bang programa ang government when it comes to treatment for prostate cancer po?
Okay, actually, meron treatment, meron program, meron tinatawag na PhilHealth package. Okay? Yung PhilHealth package was created some time back, maybe 10 years ago or something like that, na sa NKI meron yan na PhilHealth package. If you're diagnosed with prostate cancer, you can avail of that. At the start, these packages were limited to low-risk disease. Bakit low risk? Kasi medyo predictable yung mga gastos mo di ba? medyo predictable yung mga gastos mo. And for those patients, ang hinahabol doon is no balance billing. Ibig sabihin, zero ang babayaran ng pasyente. Okay, zero. So, sa NKTI, meron ganun. There are certain requirements. You'll have to provide your biopsy results, all these tests. And you can avail of that PhilHealth package. Yun ang alam ko na talagang program to treat. Of course, may mga programs din, lalo na sa gamot. Okay? PCSO, meron yung Malasakit Foundation. May iba-ibang mga programa to help sa medical aspect. Yung binanggit kong PhilHealth package, that's for the surgical aspect. Yung mga kailangan maoperahan. Yun. So meron ng government. Ang kulang siguro natin, not the government, pero siguro ang kulang in general is awareness. And that's why yung PSUO, we started this initiative actually during the pandemic. Kasi dati ang PSUO would only have one annual convention per year. That was our event. But during the pandemic, tama-tama, president ako noon. Naalala ko, sabi ko, pabira naman. Kung kailan ako presidente, wala akong magagawa. Kasi pandemic, lockdown, di ba?
Right.
So, I like saying this we tried to look for the opportunities amidst all these challenges. So, challenge of the pandemic, lockdown. But what was the opportunity? Everyone now turned to social media. Nasa bahay ka lang. Ano pang gagawin mo, di ba? Magva-Viber ka, magfa-Facebook ka, mag-YouTube ka. And so we tried to start on that. We emphasized the importance of prostate cancer awareness, and we started our campaign there. We released mga infographics. So, yun ang nakita namin na paraan to continue on with the objectives of the PSUO in spite of all the challenges of the pandemic. And I'm glad to say, 2 years ago, nag-link up kami kay Miss Menchi, and she's been helping us. And, to you guys, thank you for really considering us to be part of your program, because you're helping us more than you think. Kasi sa mga viewers nyo, and you know why I'm very concerned about it? There's a WH agency paper called the Globocan. Globocan stands for Global Cancer Observatory. It tries to predict the different cancers worldwide worldwide. Okay? So it tries to predict and project yung magiging incidence of prostate cancer, of different cancers worldwide. What was very glaring to me, what stood out was they were projecting the incidence of prostate cancer worldwide and in the Philippines. Now, the increase in the incidence of prostate cancer in the Philippines over the next 25 years is much higher than the worldwide average. Okay? Not only that, the mortality from prostate cancer over the next 25 years is around 116, if I remember correctly, 116 to 120% that of the worldwide average. So what does that mean? Mas marami ang magkaka-prostate cancer sa mga Pilipino at mas marami ang mamamatay sa prostate cancer. And it's sayang, di ba? For a disease na kaya mong agapan, sayang kung magkakatotoo yun. And how do you do that? By screening. There's no other way. Sabi ko nga kanina, walang symptoms ang early prostate cancer, and that's why it's very important. Kaya I'm very passionate about that because of that finding. I really want to spread this as much as possible. May maabot lang ako sa inyo na 5 tao, 10 tao, okay na sa akin yun, di ba? And you said earlier, you have hundreds of viewers. Makaano lang ako ng 10, okay na sa akin yun. You touch the lives, you taught 10 people. That's a good, for me, mission accomplished. So again, thank you talaga sa inyo for inviting us over.
Thank you, Doc.
Yeah, thank you, Doc. Actually, you already raise awareness to 2 individuals, me and Coach Pong, kausap mo ngayon. So, in 18 years po, I'll consider na po ang magpa-screening. Sabi niyo
So alam
po,
ko na
50
edad
and above.
mo. Alam ko na edad mo ngayon.
Yes, Doc. So, ayan, very informative, no, Coach Pong. And grabe, yung point na lang na nabanggit kanina, Doc, na it's something na kayang-kayang agapan. Actually, it's a motivation, no, na magpa-screen. Kasi marami, Doc, marami akong nababasa, nakikilala. Takot na rin magpa-check up kasi takot silang malaman.
Yes.
At malaman kung gaano ka-severe kasi once na na-check, andyan na rin magre-reseta ng meds and sasabihin yung facts about the condition and nasistress sila. Takot sila ma-i-encounter yon. Pero, ayan, so at least nabigyang linaw po ngayon itong mga bagay-bagay about prostate health and prostate cancer.
You know, you're right, Coach Alvin. Whenever I have a patient who's newly diagnosed with prostate cancer, nakita ko sa chart, let's say, bagong diagnose, alam ko na the first thing that I have to emphasize to them na yung salitang prostate cancer, hindi yan death sentence, hindi yan tanning. Okay? It doesn't mean just because may prostate cancer ka, mamamatay ka na. Because kadalasan, death, di ba? Cancer is synonymous with death. Pero dito, hindi. And I think that's one of the reasons kung bakit takot yung ibang tao. Pero sayang sayang yung opportunity, di ba? Kasi kung masi-screen ka and matitreat ka, di ba? You can get rid of it. You can cure yourself of it. Yun. Pero tama. The fear is very And that's why, di ba? Kanina ko pa sinasabi na parang hindi yan tanning. Wala kayong tanning dyan. Di ba? Very important yun. May hope yan. Meron tayong magagawa dyan. So you don't have to be scared of it. You know, kung ayaw nyo, operahan ako dyan. So, binanggit ko na kanina, may radiation. Di ba? Meron talaga. Sayang lang. Yun.
Thanks, Doc.
Okay.
Parang, talagang it's very important. And especially when it comes to cancer, di ba? The stigma and the fear is ganun po talaga. And thank you, Doc, for emphasizing na there are a lot of options for the treatments. At yung mga treatments is mas advanced na compared years before, na mas less harmful and less siguro, Doc, we're about to end our program. Siguro po, final message for our audience and viewers. Dun po you can encourage them to do the screening. And for those naman po na who is fighting prostate cancer, encouragement po for them. Okay.
Again, I don't want to sound repetitive or makulit, no? Pero sayang naman po if you miss that opportunity to be diagnosed early sa prostate cancer, because prostate cancer, if caught early, is a very curable disease. Unfortunately, the only way to find out is to get screened. Okay, you cannot pick up early prostate cancer unless you get screened. So that's very important for you to go there and see your urologist and get screened. Because if you get screened and you find it early, you find out that you have prostate cancer early, it is curable. Now, for those patients who have prostate cancer, always remember na at any stage of your disease, whether you have localized disease, whether you have locally advanced disease, kahit na po yan ay kumalat sa buto, okay? Meron pong mga gamot na nabibigay para tulungan kayo. It helps, itong mga gamot na to may help slow down the progression. It will help remove a lot of your symptoms, and sometimes it will even prolong your survival. So, kailangan lang nyo magkaroon ng hope. Kailangan nyo lang magpatingin. Huwag po kayong negative. Meron akong parating sinasabi sa mga pasyente ko na may cancer na the outlook determines the outcome. If you have a negative outlook, hindi kayo magpapatingin, you will not get yourself treatment, naturally the outcomes will be negative. Pero if your outlook is positive, then the outcomes become positive. So that can only work kung kayo po yung magpapatingin. So don't lose hope. Prostate cancer is a relatively slow disease. Of course, sasabihin ng iba, walang namamatay sa prostate cancer. Meron din po. Meron din. That's not true na walang namamatay. Meron din po. Pero mabagal kasi po siya. Yun. So I hope meron kayo napulot ngayong gabi na konting information tungkol sa prostate cancer. Yun.
Ayan, thank you, Doc. Actually, ang dami kong nababasa right now here in our comment section na they're really thankful and grateful, Doc, no? Very informative daw po ang ating naging talakayan ngayong gabi. Pero, Doc, before we end our tonight's session, are there anything na gusto mo pong i-promote?
Yes, thank you. Thank you, Coach Alvin. Next Saturday, we're going to have an activity. September is Prostate Cancer Awareness Month. Actually, not only in the Philippines, but internationally, it's Prostate Cancer Awareness Month. And so the PSUO or the Philippine Society of Urologic Oncologists, try to come up with different activities that are held in September in order to help with prostate cancer awareness. Now, on Saturday, we have an activity, September 23, we have an activity, it's called the Prostate Cancer Screening Program. And this will be held Saturday, 8 to 12. There are different institutions, as you can see here, all over the country. Meron in Luzon, meron sa Paulino Garcia, which is in Nueva Ecija, meron sa Batangas, meron din in Metro Manila, as you can see here, meron din po kami sa Ilocos, meron kami sa Cebu, sa Davao. So all over the country, meron hong mga centers na pwede nyo puntahan for free screening and consultation. Specifically for men, ito po, nakasulat dito sa second picture sa taas. Men 50 years of age or older na may nararamdaman sa prostate. Okay? So yung mga pinag-usapan natin kanina, problema sa pag-ihi, mahina ang daloy, madalas ang ihi, parang may natitira, masakit, yung mga ganon. Isa kayo sa pwede magpatingin. Those na merong family history ng prostate cancer, tatay, kapatid, kahit uncle, pwede ka magpatingin. Okay? Para kayo ay ma-screen for prostate cancer. It's very important na mag-participate kayo. Walang bayad po ito. So you can just go there. On the right side, you'll see the proposed program ng iba-ibang centers. They'll be having their own lectures and cancer screening programs on that day. Sana po makapunta kayo. So it's hosted by the Philippine Society of Urologic Oncologists in cooperation with the Philippine Urological Association. Ayun. So thank you, Coach Alvin, Coach Paul. Thank you very much for allowing me to promote this. I know, sabi niyo sa akin, maiksilan tayo hanggang 9:30 kung sasagarin. Kung 9:30 na, parang nabibitin pa yung iba. Pero yun lang, sana makapunta yung mga kababayan natin, especially those na malapit dito sa mga centers na to. It's going to be, I think it's going to be a good activity for them.
Yes. Thank you, Doc. And for sure, alam ko bitin kayo at marami pa kayong tanong, pero nakakatuwa lang kasi yun nga, on September 23, in multiple locations, guys. Yes. Pwede kayong pumunta. And for the list, huwag po kayong mag-alala. Ipopost po namin sa Wellness Weekends Philippines fan page po itong mga posters na to para malaman nyo po ano po yung mga institutions na pwede nyo pong puntahan at para makapagpa-check up na rin kayo. Yon. Sige po. Marami pong salamat, Doc JV. And hopefully, we can do this again, Doc.
Anytime, just let me know. Nasa inyo number ko, anytime.
Alright.
And thank you,
Doc.
Thank you again, Doc, for this very informative topic tonight. No?
Salamat din. Salamat din, Coach Alvin, Coach Paul. Thank you.
Alright. So, yun guys, no? So, Sad to
I
say,
guess-
we need to end, di ba?
Yeah, that's all for tonight.
Gutom na kami.
Yes. Ang bilis. Yun na pala yung 1 hour and 30 minutes nating talakayan,
Yes.
no?
Yeah.
So,
So yun,
Well-
so again, Wellness Weekend Philippines is every Saturday pa din, 8 to 9:30 p.m. Kung kayo po ay isang patient group or medical society or you want to promote any condition, you can contact us. Pero just to plugging then, next week meron po tayong another episode that will talk about heart naman kasi heart month din, no? Ngayong September. So, do join us next Saturday. And for those po na nanonood, meron po tayong survey and we want to know your feedback kung paano po namin mapapabuti ang ating episode na to. So just follow this link. Dalawin nyo lang po yun. Nakapost na po ito sa comment section. So just click the link and you can answer po this
survey.
feedback form.
Feedback.
Yun.
Ayan.
Tapos,
And
go.
yeah, of course, please tune in for the announcements of ang ating upcoming World Psoriasis Day celebration this October 29th po. So we have a month and a half to prepare. So stay tuned po sa ating Facebook pages and YouTube channel. So ayan, you can always check our updates for our WWP 2.0 on our new Facebook page. So that's Wellness Weekends Philippines and of course ang official fan page ng Psoriasis Philippines.
Yun.
And
And if you wanna watch the previous episodes of Wellness Weekends Philippines, you can tune in at our YouTube channel and browse the playlist of Wellness Weekends Philippines. And yun nga po, marami pong salamat. I am Paul and with my co-host,
my name is Alvin. We were your host for tonight. See you again next week in our Wellness Weekends Philippines, your official channel for your weekly guide on health and wellness.
yeah. Good night everyone and have a great weekend. Bye.
Bye.